And here we are for the scientific focus that we have in our program, the focus, and tonight we are talking about a very common condition, especially in women. We are talking about the urinary tract infection with the acronym, which are also called by the acronym UTI, and that's why we see the video.
Urinary tract infections are a condition of considerable interest in medical practice because of their high frequency. They are mainly observed in the female sex at any age, especially in the neonatal period and in certain risk groups. Based on the site where the infections occur, upper and lower urinary tract infections are distinguished. The upper urinary tract mainly affects the kidney and prostate, and the lower urinary tract affects the bladder and urethra. They are mainly observed in the female sex because due to the anatomy of the female urogenital system, it is easier to have bacterial contamination. Because the urethra, that is that channel that carries urine from the bladder to the outside, is shorter in women. And then because the external urethral meatus, i.e. the very exit orifice of the urethra, is close. It is in close proximity to the anal orifice, which is a rather high source of natural bacterial contamination.
Here is Panzironi, this Dr. Margherita Bovino introduced us to the pathology, calling it a very interesting, indeed she said considerable interest, so it is a very common pathology.
Yes. Very widespread. We are talking about millions of people. Consider that 10% of women today in Italy every year have a phenomenon of urinary tract infection. About 60% of women have in their lifetime contracted this type of infection anyway, and 12% of men.
Again, the doctor told us that this type of infection is more prevalent in women probably, indeed as the doctor said, precisely because of the specificity of the female genital and urinary system.
I can say that medicine always tends to simplify. Actually, I start from another concept that nature always does things right. So while it is true that clearly there is an anatomy that can lead to a greater risk of this infection, it is also true that nature gives us those weapons at our disposal that allow us to avoid the occurrence of these infections. So our question should be why? Despite this, we have so many cases of pathology precisely of the urogenital tract.
Then certainly this evening you are going to make us see this pathology from a different point than what is then official medicine, what you call protocols. Then I would say in the meantime to explain what are the symptoms of these urinary tract infections by seeing this video.
When symptoms are present, there are disturbances in urination, that is, when urinating. There may be pain, difficulty urinating, an urgent sense of urinating, even if there is then little urine put in, a sense of weight or suprapubic pain. Sometimes the urine may be cloudy and foul-smelling, or there is the presence of blood in the urine itself. When these symptoms are accompanied by high fever with more than 38 degrees centigrade, general malaise with nausea and vomiting, likely there was involvement of the other urinary tract. The findings are a plain urinalysis. If it should be altered, a urine culture with related antibiogram will be performed so that antibiotic therapy can be more appropriately determined.
Here again, Dr. Bovino basically explained to us that based on the symptoms, we can tell whether this infection affects the upper or lower urinary tract.
Yes, it is a type of infection that can start from the bladder to the kidneys. Again, the fault of this bacterium, Escherichia coli, which in fact has the ability to travel up the urinary tract. So absolutely you have to be careful with this condition because if it becomes chronic, it can even induce major kidney disease to the point of even leading to dialysis.
Then certainly this is the case where, as you always say, you have to listen to your body, and if in the case, then go to your doctor to go and see whether or not there is this kind of pathology.
Of course, we always have to listen to our body, and where we perceive symptoms that we cannot attribute to some pathology, we have to go to the doctor and try to tell him what we perceive. But unfortunately, I also have to tell you that medicine, regardless of ability to recognize a pathology, then very often it cannot even give effective therapies to solve pathologies. And even in this case, unfortunately, medicine has a totally wrong kind of approach.
Here you mentioned therapies. Let's go and see how official medicine approaches this type of pathology.
This diagnosis, it will be necessary to avoid recurrence to use drugs, antibiotics, and if possible, precisely drugs that prevent infection, parapharmaceuticals, so they are not part of the official pharmacopoeia. However, they have an action. Acidifying at the level of urine and therefore protect against infection. Clearly, to avoid this can also be used a lifestyle due to a proper diet, because habitually these subjects are subjects who also suffer from consensual constipation or have a disordered diet with a lowering of immune defenses accompanied by an abundant liquid ingestion, but not of liquids such as Coca-Cola or carbonated soft drinks, but necessarily will have to be used of low carbohydrate beverages, so mainly water or precisely unsweetened beverages are healthy in individuals suffering from this type of problem.
Here was Dr. Saida, and he told us about antibiotics and supplements that are used to raise the pH of urine. What do we want to start with?
Let's start with antibiotics, and let's say we're always at the same old thing, because antibiotics are really a very powerful drug and it can really alter our gut microbiota, as you will have major biological damage. So if anything, the antibiotic should be used for major upper genital urinary tract infections. Instead, unfortunately, we find that we use antibiotics very often, and this can lead to colonizing pathology.
Here again, Dr. Saida instead told us about supplements that are used to raise the pH of urine. What do you think?
Medicine has verified that in people who have cystitis, for example, there is a pH of the urine that is very high, and so they try to treat this pH by bringing it to an acidic phase, and then they give supplements. But we should always ask why this pH is raised, not just go and correct the effect.
Look, you have accustomed us that basically being a great scholar, when you see a pathology, you see a disease, you go to study it, you go to investigate it, you see if there is any research on it, and then you convey it to us in the simplest way possible to be able to make us understand the pathology. So at this point, I would say to present what is the real author of urinary tract infections that you anticipated earlier, and we are talking about Escherichia coli. Let's see this.
Escherichia coli is the name of a bacterium that commonly lives in the human intestine, but also in that of several other warm-blooded animals. It is particularly concentrated in the colon, then the large intestine, where it is one of the most dangerous microorganisms. Escherichia coli thus becomes part of the intestinal flora as a commensal bacterium. The adjective commensal stands for how, in the relationship of coexistence between two organisms, only one of the two benefits from such coexistence. At the same time, however, in order to speak of commensalism, the other organism must not be harmed by such coexistence.
Here's Panzironi, a curiosity. Basically, E. coli is a bacteria that we have in our intestines anyway. Why can it be the cause of urinary tract infections?
You ask a correct question, because we never have an absolute enemy. We simply have also, in this case, as is the case with many other diseases, are bacteria that are in symbiosis with our metabolism. In fact, you find it, this is Escherichia coli, inside the colon, along with a whole series of other almost 500 different families of bacteria. So we have to wonder instead why we are able to turn this commensal bacterium instead into a bacterium that can even kill us, because we remember that in the phenomenon of sepsis, even death can occur with this type of infection.
So would you like to tell us what these causes are?
The causes obviously are two important aspects that allow this bacterium to become from a commensal instead a very dangerous bacterium. On the one hand is certainly the reduction of our immune system, so we have an immunodeficiency that prevents our immune system from being able to counteract the violence of this bacterium. On the other hand, we have the problem of predisposing an overly favorable environment for this bacterium. So this undoubtedly leads to the growth of this pathogenic form.
Here you mentioned two elements, however, the causes for these two elements.
The causes for these two elements are essentially the diet. So when we eat what is provided for the Mediterranean diet, bread, pasta, pizza, potatoes, rice, legumes, we go to predispose both of these two factors. On the one hand, hyperactivate cortisol. We know that every time we have a glycemic drop, we then have a subsequent cortisol spike. And we have already explained very often that cortisol is an immunomodulator. It goes precisely to reduce that class of lymphocytes that are predisposed to kill precisely the Escherichia coli. On the other side, we said the problem of the medium, well, when we eat bread, pasta, pizza, and whatever, the sugars present are metabolized by the cells. These cells start to produce lactate, so acidic wastes that are poured into the bloodstream, and from there they have to be inerted precisely by bicarbonate. And then this bicarbonate is filtered by kidneys, and some of the calcium ends up in the urine, and this leads to raising the pH. So the problem is that this too high pH, on the one hand, indeed prevents the growth of lactobacilli, which are instead good bacteria that colonize precisely the urogenital system, but have the ability to survive only at lower acidities. And on the other hand, we predispose too favorable a terrain for Escherichia coli.
Well, it seems to me, as always, very explanatory and simple. And now, at the conclusion of our segment of the in-depth scientific, The Focus, after talking about the pathology, we are going to meet a person who has solved, who has cured the pathology that we talked about. And that's why I want to invite directly from Acate, province of Ragusa, the wonderful Sicily, Eugenia Occhipinti. Good evening. You're welcome. Good evening. Here you go. So first of all, welcome. I want to immediately ask you, when you first had symptoms of this urinary tract infection?
But the first symptoms occurred 2 years ago. That is, I started having this problem 2 years ago.
With cysts?
With a cystitis, with a simple, seemingly simple cystitis. And the first cystitis was treated normally as it is treated in most cases, with an antibiotic, a common antibiotic, and at first it passed. After a month and a half, it recurred. To my amazement, but who knows why, and was treated again with another antibiotic, thinking it was just a fluke. The problem arises when for the third time I have a quote-unquote relapse, actually a recurrence after the third month.
And there you make a urinoculture, and you find out you have Escherichia coli.
Yes, and I find that the bacteria present that was causing my cystitis was indeed Escherichia coli.
And you still continued to treat with antibiotics?
Yes, because still the traditional therapy, the protocol wants you to treat with antibiotics, the medicine says, and that's right, that's expected, the use of antibiotics, yes.
Then after 7-8 months, I read here from your file, from the beginning of the first cystitis you had worsening such that you had to go to the hospital. It seems to me you had a very high fever.
Yes, this was after a few months in the sense that I still had several rounds of antibiotics. At first the problem was resolved, but it was short-lived because they still recurred. By then it had become really chronic all the time, and I had taken a myriad now of antibiotics. Until on my daughter's 5th birthday, I woke up that morning with a very high fever. It was a uroseptic fever. It was due to my urinary problem, with crazy chills, whereupon the next day, I made my daughter's birthday pass, I only know how. The next day, I decide to go to the emergency room right away, because everything was still going on anyway, and I do an ultrasound, a renal ultrasound, where it shows that there was hydronephrosis anyway. So my kidney had dilated. This hydronephrosis was evidently due to the presence of Escherichia coli, and thus from this infection that had ascended from the bladder to the kidney. Yes, I also had another examination Also, during those days, I had a CT scan with contrast medium, which didn't show anything in particular except a kneeling of the ureter, a little kneeling of the ureter. And the doctor told me that probably this kneeling was concomitant with this infection, and so it was all related to that, in short.
You talked to me, first of all, that you were continuing to take various kinds of antibiotics to obviously fight this kind of pathology. First of all, I want to ask you, in these 2 years, how many specialists did you meet? Because I think, in short, you went to the doctor several times, even to various doctors. How many specialists did you meet?
Well, so many. So many. My problem, I exposed it to both gynecologists and urologists, and good or bad anyway, the treatment was always the same.
How many kinds of antibiotics they changed in order to treat it, and then in short time the problem would come back?
I really changed at least 5 or 6 of them, also based on the antibiogram that came out of the urinoculture. Because anyway, then maybe one strain would become a little resistant, one antibiotic, and so they would change them for me from month to month.
In the meantime, however, your partner is starting to follow the Life 120 lifestyle. However, you are not. Why?
But because I frankly was skeptical, I was objectively skeptical, and so he said no, but no, he said, you do it, let's see how it goes with you, because of some little problem he had. And then seeing that he had resolved it anyway, I had really thrown in the towel because I said enough, enough.
And I know you also stopped the antibiotics later because you couldn't take it anymore.
Yes, I stopped everything. Because then antibiotics cause other problems, which I'm not going to say here, but they are obvious in short. And so one day I decided, I said, but okay.
He convinced you?
Convinced me. I started Life 120 because he started it. And thanks to him today, I am here.
I know that you started following the Life 120 lifestyle not long ago. Exactly when?
I started practically very little time ago because it was December 2018.
December 2018. Immediately I want to ask you, after how long did you have the first benefits in general, of course?
Then I didn't believe it. I didn't really believe what I was hearing. But I had benefits after simply a few days. I already on the 3rd day that I changed my diet, I began to feel that my body was better actually.
Then let's remember that you, about 2 months earlier, had stopped doing the antibiotic treatments. After only 10 days of starting the diet, Life 120 lifestyle, did you do tests? Basically still a new urine culture to check for the presence of E. coli, and what did you find?
So after 10 days, I did my urinoculture again, and to my amazement, I saw that the bacterial growth was 0 for the first time.
Can I ask you now, how are you doing?
Now it's fine.
It's going great. So no recurrences have recurred?
No more recurrences. It continues to be, because then it's not that I stopped at the first urinoculture. I did 2 more because it was kind of like that. And so the bacterial growth continues to be 0. I have no more cystitis, no more burning, no more hydronephrosis, no more.
And we are really very happy. So I thank Mrs. Eugenia Occhipinti for being here with us.